Hi, Anna. Hi, Holly. Joanne,
Right.
joining.
Hi.
Happy Friday.
Hey there. All right. Should we just go ahead and get started now, Sam? Do we have anyone waiting?
Doing good. I'm just admitting a few final people. So I think everybody mostly knows the drill. Introduce yourself and your affiliation in the chat when you get a chance to.
Okay.
All right.
So I'll go ahead and just get started. Welcome to our Health Council talks today. Just very quickly for context, our Health Council talks are hosted on the 1st and 3rd of every month. And essentially, we just bring in resources and presenters for county and tribal health councils and for educational purposes and just resource sharing. So I'll go ahead and just do a quick handoff to Sam to read our land acknowledgement.
Thank you. New Mexico Alliance of Health Councils humbly recognizes and acknowledges we are on unceded territory and ancestral lands of the original peoples of New Mexico's Pueblos, Apache nations, and the Navajo Nation. Together, we acknowledge the history of genocide, dispossession, colonization, and ongoing systemic inequities while strengthening and respecting relationships with Indigenous peoples. We give thanks to the past, present, and future stewards of this land and respect all tribal nation sovereignty. In offering this land acknowledgement, we affirm Indigenous resiliency, self-determination, self-governance of New Mexico's tribes, pueblos, and nations who are still here today. Back to you.
Thank you so much, Sam. And so exciting, we have plenty of county and tribal health councils here today, also seeing some DOH representatives. And so we'll just go ahead and do a brief introduction and give time for Heather Maxey, who is our new hire public health and health council specialist. And so would you like to go ahead and say hi now, Heather?
Sure. Thanks, Geraldine. Hi, everyone. I am Heather, and I started last week, and I'm really excited to be here and work with you all.
And just to let you all know, Heather is essentially the new Susan Wilder. So she'll be working with you all very closely on your county health council initiatives, projects, technical assistance. So you see an email coming from Heather. That's who she is, and she's part of our team. So thank you to our county health councils who have accepted invitations to meet with her on one-on-one. So we'll go ahead and do a handoff now to our presenter, Chelsea. And so she is from the Environmental Public Health Tracking Program through Department of Health. And so I'll give her a second to introduce herself.
No problem.
Hi, just a second while I get things organized here. Whoops, wrong one. Okay. There we go. All right. Are you seeing slides?
Yes, thank you.
Awesome. Okay. Oh geez. Okay. Yeah, so I'll be talking about heat and health impacts around New Mexico. Like Geraldine mentioned, so I work with the Environmental Public Health Tracking Program, which is a CDC funded program, and it's a network of 33 jurisdictions around the country focused on environmental health and health outcomes related to environmental hazards. So our main product is this NM tracking portal that we'll go through more at the end of the presentation. And so here on the left, you can see there's the home page, and then on the right is the heat-related illness page that goes through, you know, what is it, how to recognize it, how to protect yourself and your family. It also has the data portal where you can see primarily emergency department visits, hospitalizations, and mortality data with queries that you can modify. And we'll go through all of that after the presentation as well. So some symptoms of heat illness, for anyone who's less familiar with what heat illness actually looks like and encompasses. The first sign is that you are thirsty. Heat exhaustion can look like nausea, vomiting, rapid heart rate, sweaty skin, headache, you feel weak, you feel dizzy, you get cramps, generally just not feeling very well. That can progress to heat stroke, which is characterized with a high body temperature of greater than 103 degrees Fahrenheit. At that point, there's little or no sweating, red, hot, dry skin, again, rapid heart rate, convulsions, confusion, fainting, can go to coma and death. I would also point out that it can progress very rapidly from feeling okay to heat stroke. It doesn't necessarily progress. And it can go from feeling fine to heat stroke within even as quick as 20 minutes. Now for some risk factors, they're both environmental as well as personal risk factors. So environmental, the most obvious risk factor for heat illness is if it is hot outside. So hot temperature during a heat wave. The man-made environment also contributes if someone has limited access to transportation or medical care, lack of cooling centers. There's an urban heat island effect where the concrete absorbs the heat. So then in cities, you get hotter temperatures. And then some personal characteristics, age for children under 5 or adults over 65. If someone is overweight, if they have existing medical conditions such as diabetes or heart disease, if they're socially isolated, if they use alcohol or other substances. And there's also a long list of medications that can impair the body's ability to regulate temperature or inhibit perspiration, which is used to cool the body off. So I'll take a minute to talk about heat and mental health. This was a very compelling article in the Washington Post last summer. You do have to create a free account to be able to read it, but I would encourage you to read it because it was very well written. So last year in Phoenix, there was this man who has schizophrenia, had a family, had a girlfriend, got into a fight with his girlfriend and was hearing voices and walked away from his home in July in Phoenix. And within 36 hours, he was dead. It is a complicated relationship with heat and mental health. I am admittedly not an expert in this area. So one is that people with serious mental illness like schizophrenia or like bipolar will sometimes not always make a rational decision, like walking away from your home when it's Phoenix in July. There's also some things with people who have serious mental illness where their bodies are not as adept at adapting to temperature changes. And also the medications used to treat serious mental illness also contribute to making someone less able to adapt to temperature change. All right, so this slide, the graph has the red line on top is 90 degrees, the green line is 80 degrees, the orange squiggly line is the maximum temperature last summer in the Albuquerque metro area. And then the blue line down below is the number of heat-related emergency department visits that we saw, again, in the metro area last summer. So my point of showing this is that we start to see heat-related illness at temperatures that are much lower than what, especially here, we would consider extreme. Like, so we start to see heat-related visits come in when it's consistently 80 degrees. And I'll also point out that for the occupational heat standards, they all start at 80 degrees, which is proposed in New Mexico. It has not passed yet, but other states that have outdoor worker heat regulations or heat standards, they all start at 80 degrees. Now at 90 degrees, I'm not sure if you can actually see my cursor here, but this is 90 degrees, and that's when we start to see the really sharp increase in heat-related emergency department visits. And for outdoor workers, there is some mix on when the high heat provisions kick in. So some states use 95 degrees. What is proposed here would start at 90 degrees. And I think based on what we see, 90 degrees would be well justified. Also, 80 and 90 degrees is not considered extreme here at all. So the next 3 slides, I'm going to walk through emergency department visits and then hospitalizations and then deaths, all from 2010 to 2022. The graph on the left will be the number of, well, in this slide, it's emergency department visits from 2010 to 22. And then the map on the right is by public health region, with the darker red showing the highest rate or the region most impacted by heat, and the lightest region being the least impacted. So we see here that emergency department visits due to heat stress almost doubled in that time frame, 2010 to 2022, with the Southeast and Southwest regions experiencing the highest rate of heat stress. And I'll just point out to keep an eye on the Northwest corner. So now if we look at hospitalizations, we see an increase of almost 65% in that same time frame, with the Southeast and now the Northwest regions experiencing the highest rate of hospitalizations. And if we look at deaths, we see that deaths due to heat stress quadrupled in that same time frame, with the Northwest region having the highest rate, followed by the Southwest region. I also wanted to point out, so all of this information came from our portal. It is all publicly available. You can also look at it by county. So here is for Doñana County for that same time frame, just knowing that not everywhere in the state experiences heat the same way. So here we have emergency department visits on the far left, hospitalizations on the upper right, and then deaths on the lower right. And we see that in Doñana County, heat stress emergency department visits increased almost 5-fold in that time frame, with hospitalizations and deaths about doubling. So when looking at data, I always think it's very important to understand its limitations and think about what we are missing or not capturing. So with the emergency department and hospitalization data, these are annual files that we get once a year. For example, we just yesterday got the hospitalization file for 2023, and we expect the emergency department file hopefully mid-September. So it comes with a long delay once a year. On the portal, we only include New Mexico residents. We do not get data from Indian Health Services or Veteran Affairs. We only get data from the non-federally funded facilities around the state. And we do not include residents seeking care out of state, meaning we don't get data from like Texas hospitals or emergency department visits. So thinking about what this would mean, again, for Doñana County, we see, so here's Las Cruces, and then about here is La Mesa, and then anything south of La Mesa in this red circle. So these are emergency medical services, the electronic patient care reporting, I believe it is. It's the 911 calls, basically, or like ambulance and fire department services that are called out. So not all of these are transferred to emergency departments. Like some are treated and then just left at home. But of the calls that are transferred to emergency departments, all of them in this circle will go to El Paso, meaning that we do not capture them in our data. I include this slide for McKinley County, just knowing that each county, again, has its own unique characteristics. So here is Gallup, and these are the emergency medical services calls to Gallup last summer. And most of these went to Gallup Indian Medical, which again, we do not get data from. So we are also missing those and undercounting those cases. Now thinking with the mortality data, it's similar. We get an annual file once a year from Vital Records, which comes with usually a longer delay than emergency department and hospitalization. And again, on the portal, we only include the New Mexico residents who pass away. So again, thinking of Doña County, summer of 2023 set a 25-year record for migrant deaths in Border Patrol's El Paso sector. So this picture is Sunland Park, the border wall at Sunland Park, which Sunland Park is right in the corner on the New Mexico side, but bordering Texas and Mexico. And the Border Patrol's El Paso sector covers the far westernmost tip of Texas and then all of New Mexico's border with Mexico. So in that entire sector, there were approximately 130 deaths, with about 100 of those being at or near Sunland Park. And again, we don't have that information available to us. From what I can gather from news reports, the Border Patrol and or law enforcement are the most likely to discover these deaths, and then that would go through the Office of the Medical Investigator, which I will just mention here. So starting this summer, a couple months ago, we started getting monthly reports from OMI, so we can try to assess in closer to real time and have a more complete picture of the deaths that are occurring around the state. So now for the limitation of the ED file being an annual file. So last summer was the first time we really made use of, it's called syndromic surveillance. It's a near real-time emergency department kind of database. So this is from 2019 to 2023, with 2023 being this huge jump here, especially last July when it was so brutally hot. I will stress here that we use this platform uses a different definition where it's more heat related and looks at chief complaints and clinical impression and triage notes compared to the annual file, which strictly uses the discharge diagnosis. So we see more cases in this data. So it is not a direct comparison to the annual file, but it is close to real time and gives us a better idea of what is happening.
Oh, Chelsea?
Yeah.
Oh, we have a question from Gina.
Oh, sure. I can't.
Kelsey, yes, I'm sorry. I was just wondering, I live close to, well, I live in El Paso, but I work in Doña Ana County. So that's what I was wondering, the data on TVP. So these deaths, they are, because it's a tri-state area there, right? You have Mexico and then you have the two border states, American states, Texas and New Mexico. So what you're saying is that they're, since it's in the border, are those cases reported or they were just found? Can you explain that a little?
Yeah, thank you. And I will say it is not super clear or transparent to me.
Okay.
So there were these two articles last summer, one in the Santa Fe New Mexican and one in the El Paso Times, that it seemed like they were getting their numbers from Border Patrol. When I looked at Border Patrol, their website had a long delay in reporting and also used like the fiscal year. So then it was like it broke the summer in half and it was really challenging to try to make sense of what Border Patrol had publicly available. I will say, so these numbers came from the news articles. With OMI, and I'm trying to figure out more how this process works. So if anyone has suggestions of like who I could talk to, that would be really helpful. We did get, well, okay. So vital records in theory should include everyone who dies in New Mexico, whether or not they are a resident, whether or not they are US, it should include everybody who dies in New Mexico. That is what we don't get until, honestly, God only knows. We don't have it yet. We don't have an estimated date for 2023. So I did put in a request and get the 23 data from OMI, thinking that would at least be something to start with. And most of the heat deaths appear to go through OMI. If we look at like 2022, most of those went through OMI, because in the data we get from vital records, we can see a flag that says whether or not they were investigated by Office of the Medical Investigator. So I would expect OMI to have most of the heat deaths, with some coming in through vital records that didn't go through OMI. I will say I was surprised at the number from the OMI report. It was about half of what I would have expected based on these news articles. Not sure how well this is actually answering your question, but yeah. So we'll see what the actual vital records for 2023 look like. Yeah, did that answer your question, or just lead to more questions?
Yes and no. Yeah. So yeah, I understand what you're saying, that maybe the fiscal year federally is different from the rest, and they're collecting different numbers. Okay, so thank you. Very interesting.
Yeah, and I mean, we'll see. I haven't looked to see if Border Patrol has released anything that would include last summer. I mean, the main thing is with the fiscal year that starts like July 1, so then it breaks the summer in half, basically. So if we're thinking of summer as like one cohesive summer heat kind of event, then using the fiscal year.
Right. Yeah,
makes
because
sense.
it's like the monsoon season starting in June and collecting in until September. So if you break the summer, and yeah, it's not going to be, I guess, the same numbers, but yes, I understand. Thank you so much.
Yeah. Other questions before we go on?
Oh, Chelsea, if I missed it, what is OMI?
Office of the Medical Investigator.
Thank you.
Yep. Anything else? All right. I think we were here. So using the syndromic database, or the near real-time emergency department visits, we looked at, try to see what we could assess from it. So one thing we looked at was race, ethnicity, and so this high part over here is unknown, which, given the high percent of unknown race, ethnicity, means we can't really draw any conclusions about disproportionately impacted populations. The downside to having near real-time data is that it can get pretty messy. Yeah, trade-offs. So we did see about 2/3 were male, which was in line with what we see in the emergency department annual file. Also, with this near real-time data, we get, I believe I mentioned, we have access to the clinical notes, including like triage notes, chief impressions, clinical impressions. So I will say about half of those are left blank. But with the ones that do have context, we can see something about outdoor workers. So overall, there was about 6% of the visits were among outdoor workers, or about 13% with context, and about 10% with context or among the unhoused population. And then we also looked at mental health, because as I mentioned previously, that has impacts on heat. So about 2.7% had schizophrenia, schizoaffective disorder, or bipolar disorder, and almost 6% had a broader mental illness. And that's the query that's built into this database. Very excited to say, as of this summer, we have released our heat-related emergency department dashboard, which we'll walk through after the presentation as well. So this has, from the near real-time emergency department data, we can see the red is maximum temperature, the blue is minimum temperature, and then the black line here is the number of cases per 10,000 ED visits. And then if you scroll through the tabs, you can see the ED cases by year. So for this one, the dark purple is 2024. So you can see for June, we surpassed any previous years. And for July, this was probably from a week or two ago. Now July is up here, I think. So we'll go through that. We also have urban heat maps for 26 cities around the state. These were developed in partnership with Florida State University and University of Alabama at Huntsville through the acronym NASA HACAST. So it's the NASA Health and Air Quality Applied Sciences team funded Florida State and University of Alabama to work on these for us. So this is an example of Las Cruces with the daytime surface temperatures, with red corresponding to hotter areas and the blue corresponding to cooler areas. I meant to update this because this would probably look different now. There's the National Weather Service heat risk map that has a forecast out for about 6 days out. This was from the end of May, so it would probably look different now. But basically the heat risk goes from green, where there's little to no risk, all the way to magenta, which is extreme risk. And this was developed in conjunction with CDC using mortality data from heat. And then we have preliminarily some estimates of how it works with our emergency department visits. And the preliminary results show the dose response of where you would expect, like yellow sees an increase in emergency department visits, orange you see more, and then red and magenta, the risk of going to the emergency room goes up even more. So now on Earth Day this year, CDC released its kind of version with the National Weather Service heat risk, where with this one, you go through and you select your county of interest, and then it tells you, today's heat risk, and then has links to how to protect yourself. We'll also give you the heat risk for that county for the next, 5 days. Shows you the map so you can see how you're doing relative to others. It's also nice, it pulls in air quality data so you can see both heat and air quality in one place. The main downside I see to the CDC version is that it's really built to look at it by individual counties. So if you're looking at a broader area, it might not really be your best option. You might be better off looking at the National Weather Service version. But if you are interested in like a specific county, it seems like this would be a good tool to have. I also just wanted to point out, so we put on a heat planning workshop at the Partners in Preparedness meeting in April, I believe. Maybe it was May. And someone brought up there that the people they work with don't have electricity. And so a lot of, like air conditioners and other cooling strategies don't necessarily really apply. So this is a resource from PNASH, which is the Pacific Northwest Agricultural Safety and Health Center, I believe, of ways to keep cool inside your home as well as outside your home and in the community. And then we have a document with, some environmental ways you can plant trees around your house. Structurally, you can open the windows at night and in the morning and then close everything down in the daytime. If you put up outside awnings to kind of create shade or tarps over the windows to block out the sun from coming. And then personally, you can always use water rest shade, which is the real, it's what you hear a lot in the occupational world for heat, but I think it also applies to people where, you drink water, you rest in the shade, take breaks, go at a slower pace, wear light colored, lightweight, loose fitting clothing. And then just how we are trying to communicate, and this is definitely a work in progress. We have our portal. We can post things in our newsroom as well as like the content page with downloads and resources. We put out press releases. Those get picked up by media. We have social media posts through the NM Health or DOH social media. What is that? Accounts. Also some reports, data requests, our new dashboard. If you're interested, you can sign up for NM Health e-news. Anyone didn't know. And then just before we move on to the next part, so heat stress is increasing. We expect this will continue as temperatures continue to increase, and the southern and northwest regions are experiencing the highest rates of heat stress. And here's my contact info. Please feel free to follow up after. If you think of questions later, let me know. I'm gonna maybe stop sharing for a second so then I can see more what is happening, because it's always hard to, oh, okay. Well, now I can already see people again. Hello. So I think next we were gonna go through the portal and the dashboard. I guess, does anyone have questions at this point before we do that?
I have a question, Chelsea. Is there any data? I know you had a slide about heat and its and mental illness. You mentioned I think some of the work with Phoenix in Arizona, but do we have any data for New Mexico around that?
The short answer, not yet, not really. So I've talked with our mental health epi, Dylan Pell, and it's something we are thinking about. And I mean, I think at this point it's pretty clear we need to do it. But we have not done it yet. But I will be very interested to see what it looks like here.
Perfect, thank you. And then just one more follow-up, the limitations with IHS data. Is that just because IHS chooses not to share their data, or do they have other forms of sharing health related or health related, like emergency department visits?
So this is one I have never honestly been completely clear on all of the limitations or like barriers. I know part of it is, so we have a tribal epi position here at Department of Health that was vacant for many years and now is filled. Previously, I think that position helped facilitate get at least some information from Indian Health Services. I know there is also like data sovereignty for tribes is very important. And I fully appreciate that. my challenge is, you know, if we're thinking about areas that are most impacted or where to allocate resources, if we are missing the complete picture, then it's hard. It's hard. So I'm hoping along these lines, we have an intern from UNM starting next month, who will be looking specifically at characterizing heat illness among Native Americans and the tribal populations, which I'm very glad she's coming in to look at this. So I think we're going to start with the death data because that is the most complete data that we have. Also, obviously, the most severe outcome. Another thing that I'm hoping she will have time for is looking at emergency department visits and then looking at the EMS calls to sort of try to basically try to get a handle on how many emergency department visits we are missing or that are going to Indian Medical Center or services that like we don't get, just to have a sense of like the scale.
Thank you so much. Yeah, no, that's helpful to know. And you know, thinking about that graph you showed by race and ethnicity, you know, thinking about if the data was complete, how different that would look for Native Americans or American Indians in New Mexico. So just curious, I thought I'd ask. Thank you.
No, I appreciate the question. It's one that has bothered me since I started here like 3 years ago. I'm like, I want all the complete data. Yeah. Other questions before we go on to the portal?
I have a question, and I think you kind of already talked about this, but I might have missed it because I wasn't looking at all the slides, so I apologize. What were you sharing about kind of the projected heat increases for the state? Did you kind of go into that?
Yes, let me see or I don't know how quickly I'd be able to pull this up. Usually I have the weather guys present on this first and then I talk, so they set the stage. Good question. So around the state, temperatures have been increasing, not the same all the way around, or not completely uniform around the state. That is projected to continue. I'm trying to remember the exact numbers. I don't remember the exact numbers. I'll have to get back to you on that. But yeah, I mean, basically we have been getting hotter since 70s-ish, and then it's projected to continue. Sorry, I should remember this because I've heard the weather guys talk about it a few times and I'm not pulling up the exact number. I will get back to you.
That's okay on the exact number, and I'm sorry, I know I'm in a loud place. Yeah, it's just even like a general sense of where we are thinking the temperatures are going to be going in the state over the next, 5 years would be awesome. And the second question is, and maybe Geraldine was asking this, so much great information that you're collecting and sharing. And I'm curious if you guys sit at a table within the state government that's looking at kind of mitigating some of these outcomes with initiatives statewide to decrease how hot it is in New Mexico.
Yeah, so there's we have we chair like within our, I am the chair of the there's a climate health and adaptation work group that brings in people from the environment department, from DOH. There's an advocacy group that works in climate. MNERD, which is Energy Mineral Resource Natural Division, I believe. I might have gotten the acronym somewhat flipped. And we meet, and pretty much all things climate are fair game for that group. MNERD has funding, and they just put together a climate adaptation and resiliency plan for the state, and just did a round of community conversations earlier this spring. I think they might have finished in like June. And then Environment Department also has some climate funding. We in DOH there's a proposed climate program that has to go through the state legislature. It has failed twice. We will see about this time. That would include a general fund for communities and other organizations to be able to apply for money directly to work towards mitigating and adapting for climate change. And I think that would be a pretty broad definition. Like, one thing that came up is like elderly who have a harder time clearing the brush away from their house for like wildfire risk. Like, that fund could be used for that. So right now I would say, yes, we have talked, and like to get this climate and adaptation plan together, there were a series of 3 workshops last year that MNERD kind of hosted, and DOH and other agencies were involved in. And then before the plan was released, we all had a chance to comment on the drafts, and it went through our leadership and their leadership, everybody's leadership. It has been very slow. It feels like we need stuff now. Did that answer your question? Not really.
I guess I'm curious if you might be able to share like what some of the specific strategies are statewide. I mean, I hear let's make some funding available for communities to do stuff, which is great. Though I think we see in our state that, well, anyways. So I'm also just curious if the state has any initiatives that or strategies that they are implementing to reduce the amount of heat that we sort of trap in the state. I'm talking things like planting trees, regulating, pressure fine or kind of rocks being put out all over for landscaping, supporting water catchment. I'm not a an environment or climate specialist, but I'm just curious of that plan that you talked about, if you might be able to name like a couple of the specific strategies that the state is doing to not only like bolster our hospitals to be able to respond to heat illness, but to do things to change the natural environment in our state so that it's not so hot.
Yeah, that is a very, very good question. Honestly, I wish I had a better answer for you. I put the link to this in the chat. I mean, how to say this? I think, yes, people are trying, and within like Environment Department with like all the different water bureaus and Office of the State Engineer. I went to a water leaders conference in December where there was a lot of talk about managing water and knowing that water is a very limited resource and how to protect it and allocate it, and the best ways to like make sure we are using it as efficiently as possible, and not losing it or letting it evaporate. In that sense, I don't think that it is as cohesive as it could be across the state, where people are really fully on the same page and aware of what everyone else is doing and working towards. It still feels pretty piecemeal, honestly. And for, yeah, I mean, reducing emissions and stuff, a lot of that I think would have to come through the legislature. And oil and gas obviously is big here. Yeah. But here, there's this report with the strategies. So I guess 14 minutes, should we take a pretty quick look at the portal and then go through the dashboard? And
Yeah, that works, Chelsea. Thank you.
okay. So this is what the this is what the homepage looks like for tracking. So if you're looking for the heat content page, you can go to health and then scroll here, climate related illness. Here's heat. We tried to put links to the dashboard wherever we thought somebody might look for them. So there's one here, and then it goes, you know, how to recognize and treat it, who's at risk, health tips, and then downloads and resources. This is a report I put together from last summer, going through the near real-time data, as well as some EPI reports that we've published and other resources. This is what the summary looks like. Oops. There we go. So we start with statewide, how many visits there were, how many days over the different thresholds by age and sex and race, ethnicity. And then looking at statewide, so the black dotted line is statewide. The green line is southeast, this one's southwest, northwest, all above the state average, and then the metro and northwest areas, northeast areas being below. And then if you want to look at the actual data itself, you can go to the data portal. We also have indicator reports, where these are static reports that go through trends over time and kind of puts it in context. So like this would be the indicator report for heat illness. So again, like, why is it important? How we define it? How are we doing? The graphs, and then how it's calculated, the map for 2022, and then looking at it by sex. So men have a much higher rate than women. And then if we go back here, we can go to the data query itself, which this is how I generated all of the figures for the presentation. So looking at heat stress. And then so the default results are just the most recent year of data, which would be 2022 for all of this. Or you can build the query to your heart's content. So we can look at 22 to 2010. If we want to look at a specific county, I don't want Santa Fe. Look at Luna. And then if you want to break it down into sex or race, ethnicity, you can do all of that here. You can display it either as a map, we'll do by year, however you want to, whatever makes your heart happy, you can look at it in the query. Hopefully it won't be too slow. I see the question in the chat about maternal health. Yeah, the environment department, as far as I know, would not be looking at it. It would be within DOH. And as far as I know, the maternal health kind of unit, I don't think so is the answer. We should.
Excuse
So
me.
one, oh yeah.
I know that in El Paso at UTEP, they were looking at maternal health and the impact of heat stroke and, all those challenges. There were promotoras working on this project. Who's asking this? David. Okay. Maybe, I don't know if you're interested in that project. I can probably try and get the information and see if I can provide whatever project that they worked on. And I don't know the reason why you're asking for this, but maybe it can give you an idea of what they were doing.
I would definitely be interested in that. Because pregnancy is another a risk factor for heat because it's harder to cool your body off when you have two bodies to cool off.
Eugenia, this is Joanne Lopez. I'll put my email in the chat. I would also be interested in that.
Awesome. We are gonna move on from this page because it is being painfully slow. I think it's feeling the pressure, so we'll go on. This is what the dashboard looks like. So I'll put this also in the chat. So the default is, it says, as of the last update, which was yesterday morning, there have been 567 heat-related emergency department visits since April 1st of this year. This is new since we just got the OMI report. So there was one heat-related death in April that occurred in Doñana County. We get the OMI reports on a monthly basis with a 90-day delay. So we only have April data for right now. Also, again, not all deaths go through OMI, so the deaths that we report here will always be an undercount of the true number. I like to look at the last 3 months just to see, because the default is to go from 2019. So here's statewide, Albuquerque metro area. You can change the region here if you want Southwest. Change it to 3 months, see how the Southwest is doing. Then we look at year over year incidents. So you can see here is 2024, higher than previous years for June, higher than all the previous years except for last year, so far in July. And then if you wanted to compare like June's or July's, you can search here and that'll just pull up all the Julys with the count as well as the incidents. And then the demographic factors. So we have race, ethnicity, and then by age group, and then by sex. And let's see if the query is, okay. Now the query is done, jeez. So this is for Luna County from 2010 to 2022. You can see it for emergency department visits, yes. And that is the dashboard, and I think that's all I had to cover for the portal as well. So we have about 5 minutes if anyone has questions. I guess I'll keep sharing my screen for now in case.
Chelsea, I'm not seeing any questions in chat, but I do have one about, do you have any data around the impacts of heat as a byproduct from like industrialization?
No. But that would be really interesting to look at. Yeah, that might be captured some in like our urban heat maps. I don't even know what page this is on. But you would have to, let's see, how would you do that? Oh, I thought I put it here as the thing. Sorry. Yeah, you might be able to get at that from the urban heat maps, like seeing where the kind of more industrial parts are. The problem with those are they are a snapshot in time, so they wouldn't give you like any kind of before or after or during. It's just a snapshot in time. So it would have to be like, you know, an industry that was going at that point in time.
Okay, thank you.
Yeah.
All right, I am not seeing any more questions in chat right now. Okay, well, so what we can do is we will send out the recording, all of the resources and links. And then Gina, if you could also share that article, that would be great. We can get it out to health councils next week. But if there are no further questions or comments, we can go ahead and end today's Health Council Talk session. And thank you, Chelsea, for joining us today and giving us plenty of helpful information and ways to find the data that is specific to your health council and their counties, the respective counties. So, thank you.
Geraldine, do you want me to send this to you? I mean, I know I have the specific emails, but can I forward it to you so you can distribute it to everybody else?
Yeah,
Wonderful.
Forward to me. I'll send to Sam, and Sam will include it in our announcement.
Wonderful. Thank you so much.
Yeah. Okay. Oh, thank you. Oh, so Chelsea, you got to thank you for this amazing presentation. So yes, we all appreciate it. And until next time, we'll be sure to send out announcements on Health Council Talks and send out the recording from this one today. So thank you all and have a great weekend.
You too.
Thank you.
Thank you.
Bye.
Bye.